Welcome to my channel. In this video, I'm going to explain about Chlamydia trachomatis. First, what is the general characteristic of Chlamydia trachomatis are? It is gram-negative bacteria. It shows spherical and rod-shaped bacteria, capsule endospore and motility are absent in Chlamydia trachomatis. Respiration of Chlamydia trachomatis is aerobic respiration. Where Chlamydia trachomatis are presented means it is present at the site of genital tract, cervix and urethra of adults. Chlamydia trachomatis, it is also called as energy parasite, which means it can't prepare its energy by itself. For its energy, it should be depend on another host. It is called energy parasite. In chlamydia, there are three species, which is Chlamydia trachomatis, Chlamydia psittaci and Chlamydia pneumoniae. In this video, I am going to explain about Chlamydia trachomatis. What are all the virulence factor which is presented in Chlamydia trachomatis means there are the cell wall structure, type 3 secretion system, Chlamydia cryptic plasmid, protein, CT135 and translocated acting recruiting protein. These are all the virulence factor which is presented in Chlamydia trachomatis. Chlamydia trachomatis, it is a sexually transmitted disease. In humans, Chlamydia trachomatis cause two type of disease, which is lymphogranuloma venereum. In short form, it is called it as LGV and trachoma. These are all the two diseases which is caused by Chlamydia trachomatis. First, I am going to explain about lymphogranuloma venereum. In short form, it is called it as LGV. LGV, it is a primarily an infection which is start at lymphatic and lymph node. In lymphogranuloma venereum, there are three stages. In stage 1, the bacteria enter through the breaks in the skin or can cross epithelial cells of mucous membrane. In about 3 days, it causes small skin lesions which seems to be a ulcer at the site of the infection, but heals so quickly. Some of the people, it may pass unnoticed. This is the stage 1 which is occur at the infection of lymphogranuloma venereum. In stage 2, the organism which is travel from the site of inoculation to lymphatic system. The organism, it is start to multiply at mononuclear phagocytes of the lymph node. Inguinal lymph node, which is the lymph node which is presented at the sides of the thigh, it is called as inguinal lymph nodes. These lymph nodes are starts to enlarge. It seems to be large, tender masses, and it is called as a buboes. And after that inflammation of the lymph nodes, the organism starts to multiply in the sinus tract. From that, a pus and blood starts to discharge. This is the stage 2 in lymphogranuloma venereum infection. In stage 3, lesions heal with scarring, but sinus tract can persist or recur. Persistent inflammation Due to untreated infection, it obstructs the lymphatic vessel and it starts to swelling and skin sores. These are all the stages which is occurred in lymphogranuloma venereum. Next, what are all the symptoms which occur in lymphogranuloma venereum infection are? This lymphogranuloma venereum, it affects both male and female. This LGV, which is lymphogranuloma venereum, may begins as a self-limited painless genital ulcer. Most of the people, they doesn't have any signs or symptoms, hence rarely the people notice a primary infection. What are all the symptoms and signs or occur during lymphogranuloma venereum are painful urination, vaginal discharge in women, discharge from the penis in men, painful sexual intercourses in women, bleeding between periods and after sex in women, and testicular pain in women. These are all the symptoms in lymphogranuloma venereum. And after that, what is the lab diagnosis for lymphogranuloma venereum are detecting antibodies to chlamydia and complement fixation test, immunofluorescent test, ELISA, which means enzyme linked immunosorbent assay, and polymerase chain reaction. These are all the lab diagnoses for lymphogranuloma venereum. After that, what is the treatment for lymphogranuloma venereum? There are few antibiotics to treat lymphogranuloma venereum infection are tetracycline and erythromycin. In severe stages, drainage of the buboes for symptomatic relief. These are all the treatment for lymphogranuloma venereum. And after that, a second infection which is called trachoma. This trachoma, it is also caused by Chlamydia trachomatis. This trachoma, it is a bacterial infection that affects eye. It is a contagious, which means it can spread easily from infected person to healthy person. How it starts to spread means it can spread through contact with the eyes, eyelids, nose or throat secretion of infected people. It can also passed on by handling infected items such as handkerchiefs. These are all the transmissions in trachoma. Next, what are all the symptoms in trachoma infection are mild itching and irritation of the eyes and eyelids, roughening of the inner surface of the eyelids, discharge from the eyes containing mucus or pus, eyelid swelling, light sensitivity which is photophobia, and eye pain. These are all the symptoms of trachoma. And also when trachoma it is an untreated condition, it can lead to blindness. Almost 6 million people have become blind. 10% of the world's population are at risk. This Chlamydia trachomatis, it is the leading preventable cause of blindness worldwide. In trachoma infection, children are affected a lot when compared to adults. Next, trachoma risk factor. For whom this trachoma will be a risk factor means for poverty people, crowded in living condition, poor sanitation, and it can also transmit through flies by mechanical vector, and lactoflactrines which is called a poor hygiene. These are all the risk factor for trachomas. Then how to treat trachoma infection. There is no vaccine is available, but this infection it is preventable. There are some antibiotic and ointments or preferring for trachoma, which is called tetracycline eye ointment or oral azithromycin. In later stage we have to do a surgery. These are all the treatment for trachoma. Next, disease caused by Chlamydia trachomatis. What are all the common diseases which is caused by Chlamydia trachomatis are trachoma, conjunctivitis, proctitis, urethritis, salpingitis and lymphogranuloma venereum. These are all the common diseases which is caused by Chlamydia trachomatis. Thank you.